Disease X, the silent pandemic threat that could dwarf COVID-19. The looming threat of Disease X. Are we prepared for the next pandemic? Hello, beloved viewers, and welcome to another episode of our channel Astro Stoic Wisdom. I'm your host, Deepankar Biswas, and today we're diving deep into a topic that might just keep you up at night, but knowledge is power, and that's exactly what we're here to give you. Imagine a world where a new disease emerges, spreading faster than wildfire, catching humanity off guard. No, this isn't the plot of a sci-fi thriller, it's a very real possibility that scientists around the globe are working tirelessly to prevent. In this video, we're going to explore the concept of Disease X, a term that might sound like it belongs in a comic book but is at the forefront of global health concerns. We'll delve into why influenza, a virus we often dismiss as just a seasonal nuisance, might be the next big threat to global health. And most importantly, we'll discuss what this means for you and what we can all do to prepare. By the end of this video, you'll have insider knowledge from top health experts, understand the potential risks we face, and be equipped with actionable steps to protect yourself and your loved ones. So, grab a notepad, settle in, and let's unravel the mystery of Disease X together. What is Disease X? Disease X isn't a specific illness you can look up in a medical textbook. It's a concept, a placeholder term coined by the WHO in 2018. Think of it as a wild card in the deck of potential pandemics, an unknown pathogen that could emerge seemingly out of nowhere and cause a severe international epidemic. Now, here's where it gets interesting. According to a groundbreaking 2024 survey conducted by the International Society for Infectious Diseases, 57% of senior disease experts believe that a strain of influenza virus is the most likely candidate to become the real-life Disease X. But why influenza? What makes this familiar foe such a formidable threat? Let's break it down. The influenza threat. When most of us think of the flu, we picture a few days in bed with chicken soup and daytime TV. But the reality of influenza is far more serious, and potentially catastrophic. Let's start with some sobering numbers from the World Health Organization's 2024 Global Influenza Strategy Report. Every year, up to 1 billion people worldwide contract seasonal flu. Of these, 3 to 5 million cases are severe. Between 290,000 to 650,000 people die annually from flu-related respiratory causes. But here's the kicker, these numbers represent normal flu seasons. The real threat lies in the virus's ability to change and adapt rapidly. This ability to mutate is what makes influenza a prime candidate for Disease X. Every time the virus replicates, there's a chance for genetic changes. Most of these changes are insignificant, but occasionally, a mutation can result in a new strain that our immune systems have never encountered before. In other words, we're in a constant arms race with influenza. And sometimes, the virus makes a leap that we're not prepared for. This brings us to one of the most concerning influenza strains on the radar of health experts worldwide, H5N1. The H5N1 Scare. H5N1, it might sound like a random combination of letters and numbers, but this particular strain of avian influenza has been keeping epidemiologists up at night. In early 2024, the World Health Organization raised alarm bells about an unprecedented surge in H5N1 cases, particularly in parts of the United States. But what makes H5N1 so terrifying? 2 words, fatality rate. According to the latest WHO data, since 2003, when H5N1 first began to spread widely, 52 out of every 100 patients infected with the virus have died. That's a fatality rate exceeding 50%. To put that in perspective, COVID-19's fatality rate is estimated at around 0.1%. But surely, such a deadly virus wouldn't spread easily, right? Well, that's where the unpredictability of influenza comes into play. The good news is that currently, H5N1 doesn't spread easily between humans. The bad news: viruses are unpredictable, which brings us to our next point. The unpredictability factor. If there's one thing we learned from the COVID-19 pandemic, it's that a global health crisis can emerge seemingly out of nowhere. Disease X, by its very nature, embodies this unpredictability. When it comes to influenza, its unpredictability is rooted in its unique genetic structure and replication process. Unlike many other viruses, influenza has a segmented genome, which allows for a phenomenon called genetic reassortment. This ability to swap genes is what makes influenza so unpredictable and potentially dangerous. A relatively harmless seasonal flu virus could potentially combine with a more virulent strain, like H5N1, creating a new virus that spreads easily between humans while maintaining a high fatality rate. Moreover, influenza viruses can jump between species. The 2024 H5N1 outbreaks in US poultry farms serve as a stark reminder of this threat. While rare, every human infection with a bird flu virus is a chance for the virus to adapt to human hosts. With this level of unpredictability, the question becomes, are we truly prepared for disease X? Are we prepared? In the wake of COVID-19, you might think we'd be ready for anything. And in many ways, we are better prepared than ever before. But the truth is, we're still vulnerable. On the positive side, the COVID-19 pandemic accelerated vaccine development technologies, particularly mRNA platforms, which could be quickly adapted to new threats. Global health surveillance networks are more robust than ever, increasing our chances of detecting a new pathogen early. Moreover, while we've improved our ability to develop vaccines quickly, issues with manufacturing capacity, equitable distribution, and public trust in health measures persist. So, while we're better prepared than we were before COVID-19, there's still much work to be done. But here's the good news: there are concrete steps we can all take to help prepare for disease X. What can we do? Now, I know what you might be thinking. I'm not a scientist or a policy maker. What can I possibly do to prepare for a global pandemic? The answer is, quite a lot. Here are 5 key actions you can take. 1. Stay informed, knowledge is power. Follow updates from reputable health organizations like the WHO, CDC, and your local health department. But be critical, learn to distinguish between credible information and misinformation. 2. Support global health initiatives, whether through donations or advocacy. Supporting organizations working on global health preparedness is crucial. Remember, in our interconnected world, an outbreak anywhere is a threat everywhere. 3. Practice good hygiene. Yes, it sounds basic, but it's incredibly effective. Regular hand washing, covering your mouth when you cough or sneeze, and staying home when you're sick are simple yet powerful ways to prevent the spread of diseases. 4. Get vaccinated. Annual flu shots aren't just about protecting you from seasonal flu. They help researchers track circulating strains and prepare for potential pandemic strains. Plus, maintaining high vaccination rates in the population creates a barrier against rapid disease spread. 5. Advocate for pandemic preparedness. Let your representatives know that pandemic preparedness should be a priority. Support policies that strengthen public health infrastructure and global cooperation. Remember, preparing for disease X isn't about fear, it's about empowerment. By taking these steps, you're not just protecting yourself and your loved ones, you're contributing to global health security. Our insights. As we wrap up this deep dive into disease X and the potential threat of an influenza pandemic, I want to leave you with a message of hope and empowerment. Yes, the threat is real. The unpredictability of influenza, and the potential emergence of new pathogens presents significant challenges. But remember this: knowledge, preparedness, and collective action are powerful tools. We've faced pandemics before, and each time, we've emerged with new knowledge, new technologies, and a greater understanding of what it takes to protect global health. The very fact that we're discussing disease X, preparing for unknown threats, is a testament to how far we've come. But our journey doesn't end here. In fact, it's just beginning. And you have a crucial role to play. So, here's my call to action for you. 1. Share this video with friends and family. The more people understand these issues, the better prepared we'll be as a society. 2. In the comments below, let us know, what steps are you taking to prepare for potential future pandemics? Your ideas might inspire others. 3. Hit that subscribe button, and notification bell. We'll be bringing you more in-depth content on global health issues, and you won't want to miss it. Remember, in the face of disease X, we are not helpless. We are a global community, armed with science, united in purpose. Together, we can face whatever challenges come our way. Stay curious, stay prepared, and above all, stay healthy. Thank you for joining me on this journey through the world of disease X.